Let's get back to President Trump at the border wall in Arizona. The president also today gave a speech at a Students for Trump rally in Phoenix. The state is up for grabs in November. Now, Arizona is seeing a pretty bad COVID-19 outbreak, a nearly 50% rise in cases over the past week. There's also a serious COVID outbreak just south of the border. Let's welcome back to the show retired ICE acting director. He is Tom Homan. Great to see you again, Tom. Tom, before we get to the border, we want to ask you about Twitter red flagging this tweet from President Trump saying, quote, there will never be an autonomous zone in Washington, D.C. like there is in Seattle. If they try, they will be met with serious force. Now, Tom, Twitter flagged that as for violating Twitter policy, saying it contains a, quote, threat against an identifiable group. Your reaction?
Twitter's out of control. Well, the president's saying he's not going to allow lawlessness. He's not going to allow people to, damage property and commit crimes. He's a law and order president. Twitter is just wrong on that classification. Dead wrong.
Okay, let's get back to the president visiting the border wall today. More than 200 miles built. Let's listen to what the president said. Watch.
It's really foolproof. It's solid steel, it's rebar and concrete inside the steel. So we have a very heavy concrete inside the steel, and inside the concrete we have rebar. So you have everything you can have. It's what they want.
Okay, let me ask you this. Is the border wall working? It's going to cost at least $18 billion. Many oppose it, including, environmentalists saying it's creating scars throughout the landscape. Democrats say don't build the wall. What do you say?
Walls work. The data's clear. The walls they built over in Yuma, they've already resulted in an immense decrease in illegal immigration. Liz, every place they put a border barrier in the last 20 years, illegal immigration has declined. Illegal drugs being smuggled in the country has declined. The data it's clear on this. And talk about those who oppose Trump's border wall. You got Schumer, you got Hillary Clinton, and even Joe Biden back in 2006 committed $50 billion to a Secure Fence Act. So they apparently thought barriers worked, or they wouldn't have voted for the bill. So they work. The data's clear on that. Walls are is going to slow people down. It's going to have a decrease in illegal immigration, decrease in illegal drugs. Walls save lives.
Okay, I want to move on to this because we've been covering this, and it's the COVID outbreak south of the border. Tom, we're hearing that local state and hospital officials in Arizona and California say they are now swamped with COVID-19 cases crisscrossing the border. They're fearing it's going to deliver a second wave in the U.S. Arizona and California, Tom, now seeing a rise in cases versus Texas and New Mexico. It's not great in New Mexico and Texas either. But here's the thing. Mexico officials say the cases are likely undercounted due to lack of testing. South America is seeing an explosion in COVID cases. How's that going to affect the border?
Look, I wrote an op-ed on this 3 months ago saying this was going to happen. Unfortunately, Mexico didn't do the response that the United States did. Mexico was under testing. In the first few weeks of the COVID hit Mexico, they were claiming all these deaths were pneumonia related. Had nothing to do with pneumonia. It was COVID. So, and I said, disease comes across this border every day. Even before COVID, we've had TB coming across the border, chickenpox, measles that this country defeated at one point. The border isn't just about illegal immigration. It isn't just about illegal drugs. It's about disease that comes across that border every day. So another important reason to have that wall, right? To help protect Americans from the disease. But the dangerous thing is a lot of the large communities in Mexico, let's say Juarez, south of El Paso, 4 times the size of Juarez, they'll inundate the hospital in El Paso because the hospitals in El Paso have enough to do with the American population, let alone a population 4 times its size just south of the border.
The WHO is now saying the epicenter for the global outbreak is in South America. Brazil is having a really hard time. Talk to us about how the border officials have to deal with diseases and outbreaks like COVID-19. What's the impact on the border guys?
Well, that's why this president did a great thing when he suspended all immigration on the southern border, the illegal immigration. Instead of taking them into custody and putting them in an ICE facility where they sit for days and infect other people already detained, the president said, we're going to turn them right back around and send them back to Mexico. Look, this is about protecting the American people. It's about protecting our Border Patrol agents and our ICE agents. Think for a moment if COVID hit a Border Patrol station really hard. That section would be wide open to all cartel activity. So the president made a great move when he suspended immigration. He made another great move by suspending a lot of visas coming to this country. Look, it's about protecting Americans, Americans first, jobs for Americans first, the health of Americans first. This president's doing his job, putting America first, and that's exactly what he should be doing. That's exactly why we elected him. And that's why he's a great president.
Yeah, again, the fears that COVID-19 is coming across the border. Great to have you on, Tom Homan. Come back soon.
Great to see you.